Hi, my name is Shri, and today I'm going to talk about the eye using a diagram I drew. Let's get started. So this is the sclera, which is the outer coat of the eye. This is the choroid, which is the middle layer of the eye. And the third layer of the eye is the retina. This is the cornea. The cornea is the clear front surface of the eye. It is 10 to 12 millimeters in diameter. It has 5 layers. 1. The corneal epithelium. 2. The Bowman's layer. 3. The corneal stroma. 4. Descemet's membrane. And 5. Corneal endothelium. So the function of the cornea is that the cornea works as a refractive media to focus the image onto the retina. The cornea is avascular, which means that the cornea has no blood vessels. The cornea gets its nutrition from aqueous humor. So then we'll talk about the uvea. The uvea consists of the iris. The iris is a circular diaphragm with a central hole called a pupil. The iris has circular and radial muscles to change the size of the pupil as per intensity of light. The uvea also consists of the ciliary body and the ciliary body secretes aqueous humor which circulates from the posterior chamber, PC, through pupil to anterior chamber, AC. And it drains through the channel of sclem into the scleral veins. The third part of the uvea is the choroid. Now, let's continue to talk about the ciliary body. So the ciliary body has ciliary processes which attach to the lens capsule to keep the lens in position. Also, these ciliary processes are called zonules. By their contraction and relaxation, they change the accommodative power of the lens. So the lens in the eye is located behind the iris and in front of the vitreous body. It is of an ellipsoid shape. It is transparent, flexible, and can change its shape. And its size is 10 into 4 millimeters. The function of the lens is that it focuses the image on the retina. Fun fact, the lens is also avascular. Now let's talk about the retina. The retina is the inner sensory membrane of the back of the eyeball. It has 10 layers and it contains photoreceptor cells, that is, rods and cones. The cones are responsible for day vision and the rods are responsible for night vision. The cones are also responsible for color vision. This is the macula. The macula contains the maximum number of cones. It has the fovea, a small depression in the center. The fovea is responsible for maximum acuity. So now let's talk about the vitreous humor contained inside the vitreous body. The vitreous humor is a gel-like substance that fills the posterior part of the eye and helps the eye to keep its shape. The conjunctiva is a layer covering the sclera. Now let's talk about the optic nerve, which is the second cranial nerve. The optic nerve consists of millions of nerve fibers that emerge from the retina. The optic nerve passes through midbrain, decussiating at the optic chiasma to the occipital lobe. The visual cortex, which is area 32, in the occipital lobe perceives the vision. So now let's talk a little bit more about eye muscles, which are also called ocular muscles. There are 4 ocular muscles. 1. The superior rectus muscle, which moves the eye upwards. 2. The medial rectus muscle, which moves the eye medially towards the nose. The lateral rectus muscle, which moves the eye laterally, which is outwards, and the inferior rectus muscle, which moves the eye downwards. Now what about oblique muscles? There is a superior oblique muscle and an inferior oblique muscle. These two muscles help in torsional movement of the eye. The LPS, or the levator palpebrae superioris muscle, is a ribbon muscle that lifts the upper eyelid. Thank you for watching and have a great day.